Hello, hello, hello. Happy Friday. Happy Friday. We're almost at the end of the month. Happy Friday. Today is Friday. Friday chat with Abby. Hello, my name is Abby Tyler. Welcome to all my new members and followers as well. My name is Abby Tyler. I am a family nurse practitioner. I'm a content creator, the host, and also a community health volunteer. How is it in your neck of the woods? It is about 85 degrees. It's nice and breezy over here. People are getting ready for summer plans and everything in the weekend. I hope you are well. I hope you all are well and staying safe out there. Okay, so today, as you can see from the title, I'm going to be talking about stress management and tips for parents of children with chronic illness. I decided to do this because in my practice, I do see a lot of people who come in with who have children with chronic illnesses, and what is medical or mental illnesses and everything that goes along with taking care of children and the stress that comes along with it. In as much as you love your children, as with anything you lay down your life, there are a lot of stress. Even taking care of our children who don't have chronic illnesses, that can be a little rough. And imagine having somebody with chronic illness that comes along with a lot of things. So I decided to talk about this. And sometimes you want to blame the child, especially when it comes to mental illness issues. Sometimes you want to blame the child, but I was listening to this radio station the other day, online thing, and Kirk Franklin, he's the gospel singer. Everybody, I think he's a pastor also, and everybody. He's this big famous person. For those of you who don't know him, you can Google him. He had an issue with his son that had some mental issues in the past. They kept that private, of course, that's as it should be. But apparently, his son recorded him last year, and it was this big thing. And everybody was saying, "Oh my God, I can't believe he's this pastor and he's out there and he's cursing and doing this and saying to his son, his adult son." And everybody was chiming in with their thing. And he said, "We have tried our best. We put him through therapy and everything, and apparently this is what's going on." So they went through their thing, and I think recently it came back in the news that he had just gotten himself into trouble. But Kirk Franklin says something that was really revealing to, and that's something that most people don't pay attention to that much. It's like this child is going through something that, well, he's a young man, he's not a child anymore. But this child is going through something that he had no control over. That is something no fault of his own. This illness is no fault of his own. All right, he's got this mental issue and he was born with it. So that's not something that he was, that he brought on by himself. So when we as clinicians and also as parents and family members of these children, there are certain things they're going through, and we're saying, I can't believe they're doing this. I can't believe they're doing that. And it's not something they did. And sometimes the behavior can also seem like, okay, they're just misbehaving, especially when it comes to mental health. It seems like they're just misbehaving. But, in reality, that's just a symptom of the illness that they're going through. So I decided to talk about this because I know the stress that comes along with it in this world where and parents have to work, both parents have to work, or even one person stays home and one person work. That's still a little financial hardship on the person who's working. So I'm just going to go into that. Please excuse me. Let me just take a sip of drink here. Okay, so I'm going to go on. For those of you who will be joining me now, I say thank you. For those of you who will be watching later, I say thank you as well. And as always, my disclaimer, nothing I say here today, you should always check with your personal physician or doctor or provider before making any changes to your regimen. Okay? Alrighty, so I'm going to go into it. So some of the classes. Alrighty. So some of the common stresses, I took some of these from like nice articles and also from my practice as well. So some of the common stressors for parents that they have to worry about, those who with children with chronic illnesses, you have to worry about your child illness and treatment. You know how if you have to take your child to the doctors every month or every 2 months, or have to take them to different places for therapy, you know how you have to worry about you taking time off from work. You have to worry about babysitting for the other kids, because sometimes, you have other kids too, so you have to manage that. And you and your husband or your partner, whoever, or your boyfriend, girlfriend, say, okay, who's going to stay off from work? I can't afford to take any more days off. And your whole life, it consumes your whole life. So there's some of the stresses that we have to, parents have to deal with. the guilt about your child illness, because it'd be like I said, it's something that the child had nothing to do with. So you're saying that you're feeling guilty that, oh, if I had done this, if I hadn't done this when I was younger, or maybe it's my genes, if I hadn't had a child with this person, or if it's something that I carry from my genes. So you spend your whole time feeling guilty about this child illness. That's something you think that you caused. All right, balancing the demands of work, medical appointments, like I said, and hospitalizations, because there are times these kids have to go into the hospital and they're there for a while, especially for parents like things like asthma, um, cystic fibrosis, sickle cell disease. You spend most of your time, like almost at least 3 to 4 times in the hospital every year with crises, and you have to take them to the hospital, and you have to be there with them, especially in children's hospital. You have to be there, and one parent has to stay with the child. Attending to the needs of the other children, because usually when this other child, it consumes so much of your time, the other children they get neglected or may feel neglected, and you try as much as possible not to neglect them, but this other child takes so much of your time, and you have to, all of that can really cause a lot of stress on the parent, because it's like, okay, this child had to be at a football game. I couldn't go to this football game today because I had to take little Jimmy over to his doctor's appointment. I had to take little Jimmy to his physical therapy appointment, or I have to take him to the hospital, or I had other things to do. So the other children feel neglected, even though you're trying your best to do that. Less time to spend with your partners. That's why it's very important in most of these situations. The marriage, it suffers because, especially, you have to really be strong, because it really, you don't have time to be with your partner. The time you say, okay, let's go out to the club, or not club, hopefully, yeah, you can still go out to the club, but let's go out to a wedding, or let's go out to a cookout, let's go out to this. It's always like, okay, well, we can't go because one person may have to go, one person may have to stay home, because we have to keep an eye on this child. We can just pick him up and take him to a party, or pick him up and take him to that, because he can't be around too many people, or the sun is too hot, he can't be there. The cold is going to exacerbate his illness, or everything else, the anxiety, all of that. You have to think about that. Challenges in looking after your own health. And most of the time, most parents, they don't even, it's like, okay, when's the last time? Like, I would stop a parent and be like, when's the last time you went to your doctor to get checked? When was the last time you did this for yourself? When is the last time you got your mammogram done? When was the last time? All of that. And it's not like, okay, yes, I would love to do that, but I don't have the time, and I have to watch out for my kids. And, as parents, we always put our health on the back burner, because you have to sacrifice everything for your children. And then, especially for this child who really needs you, most of the time your health goes on the back burner when you have to take care of that child. Separation of family members. Again, there would be times where, I know there are times when I watch the cancer videos from what's in Judah Hospital in Florida. I think that's where it is, and they show how they give you free housing and free treatment and all that. But usually one parent has to go down with that child, and then the other children have to stay back with mom and dad, or stay back with grandma or somebody else. So they're taking away time from the other family members. And sometimes you have, because of to go to family, you can't go to other things that other family members attend, because of that, because you have to protect your child from everything. And the financial health and concerns, in as much as the insurance pays for certain things, there's certain things the insurance doesn't cover, and there's certain medications that child has to have, and insurance they'll say, no, we don't cover that. So if you're working and you're taking off from work, or one parent is not working, and you have to worry about that, you say, okay, this medication, this is what they need, this is what the prescribing, but the insurance company, so you find yourself fighting the different insurance company for prior authorization for something that your child needs, but they're saying, no, you have to try this and this and this. Well, how am I going to, we can't try this and this and this, because they'll tell you, try this and take this medication, or before you fail that medication, try another medication and fail that medication before you try the one what the doctor prescribed. And sometimes you're like, okay, who is the doctor? Is the insurance company, or is it the doctor? And then sometimes we, as clinicians, we also have to go back and forth with the insurance company too, because there are times where I prescribe a medication for a patient, and they'll say no, and I say, this patient really needs this medication, and they'll say, okay, well, then you have to have a peer-to-peer interview. So their doctor for the insurance company, I have to get on the phone with the insurance company doctor, and I have to go over everything that I list everything that I wrote before, and defend everything. And sometimes they'll say yes, okay, and then sometimes they will tell you no, we still say they should try this and this and this, and you have to go that. So now imagine if we're doing that, and you have to do that also, because some parents will take the initiative to say, no, I will call the insurance company and I will do that, and they have a right to do that as well, because it's like, my child needs this. But imagine all that stress that you have to go through. And if you're doing the kind of job that you really, every job you have to pay attention to anyways. So imagine if you have a job that you have to pay so much attention to and that's so demanding of you, but you have to take care of your child, and you have to make sure your child gets the best of what they need in order to be able to go through life. And you have to deal with all that. So it's all of that can take a toll on the parent. It can take a toll on the other children in the household. Can take a toll on the marriage, the relationship, and in as well, and also with things going on. And then the child's missing school, so you have to teach this child when this child's at home, or during the days where they can go to school. You have to get all the schoolwork, and they have to go over with this child that's going through maybe chronic pain or going through this. But you don't want them falling back in school, and you want them to have as normal of a life as possible. But sometimes that is impossible as well. Okay. So some of the common responses that people have to that, and when you have a hard time dealing with that, um, parents are having issues. They're having because they usually will come in. I'm having problem with insomnia, and then you listen to it, and you can tell why they're not sleeping enough because okay, well, you have to wake up to give this child the medication. You have to wake up if this child's going through stuff, and just it's not just younger children. You're talking about teenagers and also young adults, children who are still living in the house, and sometimes they don't want to take their medicine. They don't want to do the things that they have to do. And especially with mental issues, you sit there and you say, now I'm trying to help my child with this, that had this mental issue. The wiring and all, like Kirk Franklin said, the wiring ahead is not something that they brought on in this house. And you're trying to manage that mental issue, but it's the same head that you're trying to help. It's the same head that's telling them, no, I don't need to take my medicine. No, what? There's nothing wrong with me. No, that's something. And if they have diabetes, no, I'm tired of sticking myself. I'm sorry why my friends are going out and playing. Why am I doing this? Sickle cell, you can't be out in the sun for too long. You can't be too dehydrated. You have to do this. No, I'm tired. I want to be able to live my life normally. And it's because you see, if they don't do that, it's going to cause them more problem. And you're trying your best to get them to understand that, and they understand it, but they just want to live a normal life. And you can understand that if you're a teenager, that's not what you want to do. You don't want to be laying in the hospital. You don't want to be getting pricked. You don't want to be doing all that. You don't want to be seeing a mental issue. You don't want to be seeing a psychiatrist or seeing a therapist. You just want to live your life normally, but you can't. And it's hard for the parents to get that through to their child. And like I said, when you're going through this and you start feeling changes and you're not eating enough, you see the parent is like, are you okay? Sometimes you just ask them a question and they just like break down and start crying because there's so many things that's going on that they can't talk about, or they're trying as much to hold it all in to be strong for that child. And inside, they're like dying inside because there's too much on them. Okay, getting into arguments more often because they're short tempered. It's like, okay, I don't have the time to deal with this right now. I have to do this. I have to do this. I have to do that. I remember when I was taking care of a kid. I think I talked about it last time, and he was paralyzed. They went to vacation, and he broke his neck. And I remember I was working there, and I was getting together, and they were fixing up the house for him to live there too, the back of the house, and doing things. And I was talking to the mother. I said, I can't find what it is that you need me to do to put on your son, because I was an aide at the time. And she was like, oh my God, it's right there. You never taking care of a child that had spinal illness before, spinal injury before. I can't believe this. And she's going off, and I'm like getting in. Her other daughter just said, Mom, calm down. She doesn't know. No, even if she doesn't know, you have everything over there. Just tell her where it is. And I understood at that time. Of course, I was much younger, and I was like, oh, I'm not coming back here if this lady's going to be yelling at me like that. But in retrospect, you understand, you see, there's a lot going on. As this child was an okay child going to school, and all of a sudden their whole life has changed. Everybody's lives have changed, and they have to, this is like this new normal that they all have to get used to, and also deal with their children who are not having any issues. So that takes a toll on the physical health, stomach aches, they have other physical symptoms, they worry, they're nervous, and everything else, distraction, difficulties paying attention. And sometimes things can happen to be like, you left the key in the car. Do you know you left the key in the front door? Do you know you didn't pick up your other child from school today? And it's like, I'm not trying to be mean, but it's like I'm going through so much, and all of that takes a lot on the person. So, and that's a hard way to respond, because it's like, okay, I can tell you all that's going on, but that doesn't change my reality. It's not going to get better. This is something that we have to get used to, and it is a lot. It is a lot, and especially when you don't have coping mechanisms, is a lot, and you have support system, is a lot. Even with that, it is a lot. Okay, so what you want to do one of the ways of dealing with it, take time for yourself. Even if it's 5 to 10 minutes when everybody's sleeping, right after, even if you're laying next to that child in the bed, or that child's like laying next to you, or you're playing outside, take 5 minutes, 10 minutes, and just take time to read. Go do different things. Right now, I'm like really stressed with everything that's going on. I have to do all these different physical forms and all. And my little niece came over a couple of weeks ago and she left her coloring book. And I was like, you know what? I'm about to like get this coloring book and start coloring just to release the stress that I'm going through. So I know that. And, dealing with like young adult children too, I know all the different things that the stressful things. So it may seem a little, yeah, like, oh my God, you're going to go color in a little kid's coloring book. But you know what? It relaxes me, so why not? And they did have a thing for adult coloring book, by the way, so who knows? So go ahead and do it. Dancing, even me getting up and dancing, sitting. I usually sit on my back patio, put the music on, watch some funny TikTok videos. I mean, even 5 to 10 minutes a day, just take a little time for yourself, and know that you're not alone because other people are going through this. Choose a strategy. Like I said, find a way that you're going to relax. Find different ways, because you can say, oh, let's go to the waterfront, let's do, oh no, I can't go there, because by the time you'll get ready to go there, I will be ready to like get the next feeding ready, get the next this ready, get the next shot ready. And it's like, okay, then just go for a walk. Let's just go for a walk. Go enjoy yourself and come back. You don't necessarily have to go somewhere to get back in the car. Go somewhere, because you can't leave that child alone. So you can just get in the car and go to the waterfront, or go to different things, or everything has to be scheduled, but don't get so stressed out about it. Okay. So learning different techniques and all that, deep breathing, muscle relaxation, guided imagery. Like right now, I really hope I was back, enjoy my vacation and all different things. And I'm not trying to like simplify it because I say, okay, I have a child with chronic illness. I'm not trying to simplify it. I'm coming from the point of a clinician point of view. And I've also have friends and family members that had issues with children that had chronic illness, different kind of chronic illness, and we all had to deal with it. It was something that we all had to do. We all had to be part of the support system. Okay. Yoga, meditation. There's some things on right on YouTube. You put your TV on and some exercising that makes you relax and just deep breathe. Try to stay away from any addictive issues and all that too. Do not start smoking to relax yourself. Do not try doing any illicit drugs to relax yourself. Stay from. Don't say I'm just going to try it and it's going to make me okay, because if you have addictive personality, and even if you don't, sometimes you don't know until you start doing those things, and that's when you find out that it could be a problem. So try as much as possible to stay away from anything that's going to cause additional problems later on. Okay. And make sure you're taking care of the family, making sure that everybody understand that this sibling has an issue, but they're not always going to understand that, because it's like, okay, yeah, okay, so they have that issue. What about me? What about me? You were supposed to come to my football game. You were supposed to come to my ballet class. You were supposed to come to my dance class. And I wanted to be somewhere and I needed you to be there, but nobody was there. That's not fair. And they will lash out. They will lash out. And some of them will end up doing things that may lead to criminal activity, because it's like, okay, nobody cares about me. All they care about is this person who, my sister, or this person who had all these problems. And they think about it too. They say, what would happen if something happened to the parents? Am I going to be the one that's going to have to take care of this brother or sister? All of that, things that parents have to worry about. All right. So the main thing, some of the coping mechanisms now. So start finding resources, especially for children who are younger than 18, because you want to have all those resources in place. So when they get out of the pediatric system, you'll be ready to go into the adult system and have all the doctors like your the general practitioner. You want to make sure the social workers and everybody in place, because once you get out of all that bubble of being protected under the pediatrician and everything else that goes along, everybody else, the specialists that go along with it, you go into a whole new world, and that can bring up even more stress. So start now talking to your pediatrician and telling them, okay, this is what I'm going through. The child's getting to this age. At what point do I need to start dealing with this? So get your pediatrician involved, get the school involved. Okay, see, get the school involved. They have the school guidance counselors, they have therapists, they have psychologists, they have all this, psychiatrists too, because if they're prescribing medication, the family doctor, if they're prescribing medication, again, leaving from the pediatrician, go into general population, general doctor, and all that, adult doctor. All of that has to be understood, because you go into the adult doctor who's used to seeing adults, and all of a sudden, now this young person is like I tell parents, The first couple of visits that your child has to go through, even if they have no issues, you want to be there with them. You want to also be able to be on the phone if you can't make it with them. So it is, imagine dealing with this person who has all these other issues, and be there and talk to the doctor. And like I said, call ahead and say, I'm bringing my child in. They have this and this issues and all. Most of the time, we have people fill out the information prior to coming in. So we will kind of look it over first. Okay, and then even if you get there, you say, I have this issue, and can I please sit in, because now this child's like 18 years old. Can I please sit in and then kind of give some information, so that way you develop a rapport and relationship with the office staff, with the physician or nurse practitioner or PA, and it's like a collaborative um, care there, because you want to make sure, like I said, always say, the multiple disciplinary team and disciplinary team, but you want to make sure that you have the parents and the staff and everybody's into it. So one person could be taking care of this, one person taking care of that, and everything's together. And I tell people to take a little notebook, write some things down, so you're not frustrated when you have to come up with all these answers. Okay, which doctor did you see last week that changed this medication? And you sit in there, you're like, oh my god, I can't remember. And you can feel the frustration. So it's like I say, okay, and I tell people, I say, I'm not trying to make you feel bad. I'm not trying, and I understand what you're going through. Get a notebook and write this down, because at some point you have to be OCD about it. Okay, you have to just say, okay, this is the doctor I saw on June 1st, and this is his specialty. This is what he changed. This is the doctor I saw this, and that way it helps you. Even if you don't have children with, if you don't have children with any kind of problems, you still need to write those things down, because when you come into the doctor's office, your PCP's office, everything we ask about, everything we have to coordinate all of that. So it helps us a lot when you can help, when you empower yourself to make sure you're taking care of your child or your young adult. Okay, because you're dealing with so much already. Okay, and already, so make sure, like I said, okay, and then if you have issues with if they have issues with mental health, as they get older, like I said, they don't want to take their medicine, and their behavior can also, if they're not taking their medicine, they engage in unsafe behavior, that can also lead them into criminal activities, and which is really sad, because the police or the judge or a different thing, they may not go easy on them if they cause if they if they commit a crime that other people are suffering from, and you can say, well, they had this issue, that's the reason why. There will be times where they might say, okay, we'll give you a break right now, send you away so you can get the help that you need, but it will come a time that you will have to face the consequences of your actions for something, for an illness that you had no part in playing. It just happened to something that came on you. If you're supposed to be taking your medication for other issues and all that, for let's say sickle cells, for you're supposed to be taking some for your diabetes and all those other chronic illnesses, and you're not taking it, and you start engaging in unsafe behavior, like I said, again, you're drinking heavily because you just want to live your life. And the older the child gets, the parents start worrying, because you never start worrying about your children. You never, you worry about them when they're younger, and then you worry about them as they get older, when they gain more freedom to move around, and they're navigating in this world where before it's not the same thing. It's not the same thing as somebody who doesn't have that chronic illness. So all of that weighs in on your heart. Like my son, he wants to do his then DoorDash, and I'm like, oh, he's fine, but I just like, oh God, what if somebody who doesn't like him, or he goes to the wrong door and somebody thinks he's coming to attack them or stuff like that. So imagine somebody who has other issues. I think Holly Robinson Pete was one her son had her son has autism, and she talked about all the different things that you have to go to dealing with a child, and so especially when they become an adult. Okay, and she went through this whole thing worrying about, oh my God, what happens when he's driving and something happens and he gets stopped? Would they understand that he's got issues, that he's not going to be able to answer the questions as quickly as possible? And they might think that he's on drugs or something. So her daughter wrote a book about it too, because they were twins, and they wrote a book about my brother. And also, if you have the chance, go back and read that. Okay. And with the National Alliance of Mental Illness too, you want to talk to them. They'll teach you all the different things, the impact of mental illness can have on your entire family. There are people that have resources there, people who also went through this, and they can tell you. So it's not just from just a clinician point of view, but they'll be telling you how to help you, how to help your family members, how to advocate for your child's right in the school, a health setting, how to prepare and to respond to crisis situation. There's so many numbers. I'm going to put the numbers in the bottom there, but it's National Alliance of Mental Health, and they have and they also have crisis center. These places are like the hotline, but it's not crisis. So if your child's in a crisis, make sure you call 911. Okay, and again, call this and talk to people and find support groups, because it'll be like, oh, if I find a support groups, I don't have the time to even go to any kind of program. Doesn't, there are things online that you can deal with. And if you can't find a support group, create one. Create one. There are many things online, and some people say, I don't want to put my business online. You don't necessarily have to put anything online that's so detailed. But you can just say, okay, even if it's two people, and call somebody who also, and it helps because you can say, all right, I'll talk to their church groups, there are other religious groups that you can go to, but please make sure those people are trained. Those people are trained in healthcare, and also, there are many people who are religious people also have this training in healthcare, dual training in healthcare, where they can be able to explain to you and counsel you effectively and in the right way. Okay. And also, I say, meet with people, talk to them, and you'll be like, I can talk to my brother, I can talk to my sister, but sometimes it's just best to talk to somebody who really understands you, who are also going through that. All right. And I think here, let me go here. I think I'm gonna go one more thing before I get off. All right. So, and again, like I said, you'll be gaining resources, and these people will tell you the exact things what you need to do. But if you're younger right now, start talking to the pediatrician, start talking to the teachers, start talking to the guidance counselor, your local and politician office too. They have all the different groups and everything that you need to go through that. And for children, I know when I also work in a group home, the girls, they get to a certain point and they're like, they have issues that, like, they have, let's say, maybe a little bit of mental illness or an MR, developmental issues and all. And then they get to a point where they, of course, as they get older, they start falling in love and having feelings and all. And that's the part that really used to worry one of the parents I used to take care of the daughters. She's like, I don't want them going out there and some man will see them and say, oh, and take advantage of her. I mean, we all worry about that when we have children who don't have any issues. So imagine this young child who sees somebody and thinking this person love her, and the person is just there to like do something horrible to her. Okay. So again, breathe it out, breathe it out. Take five, even if it's 5 or 10 minutes every day to just relax. 5 or 10 minutes every day to just relax. If it means reading your Bible, reading the Quran, reading anything religious book, pray and all, but don't just sit there and pray about it. Make sure you take the time to go and get the help that your child needs. And then goes to all those resources, not to National Health and Mental Alliance. Speak to your doctors, guidance counselors, and all those different things, and just breathe it through, because it's going to be a long run. It's going to be, I'm not going to sit here and sugarcoat it. It's somebody, if you're dealing with a child that has a chronic illness, it's going to take a long time. It's going to encompass all your whole life and everybody in your family. Communication is key. You sit there with the other kids and say, tell me your feelings, tell me, and then how can we go about helping you and also help your brother or your sister who has these problems. Okay, I wish you all so many. I pray for everybody, and trust me, my patients, when I sit there, when I do the talk, and I talk to mom, I talk to dad, and I usually get them a hug. I be like, Mom, I say, Mom, Dad, it'll be okay. Just then it was like, oh, thanks. I was like, and so thanks, Abby. And because you have to give emotional support, because it's like, okay, I can just give you this, and this, and this while listening to you. And sometimes I'd like, take care of yourself. Just take care of yourself. Even if it means like taking something and just drinking nice cup of water slowly to right. Watch something distracting for, even if it's 5 minutes out of the day. Take time for yourself. Okay. Take time for yourself. Get the resources out there because they are out there. All right. Let me see if there's any. I have to put my glasses back on and read the comments. Okay, Masa Deposit, thanks for sharing. Thank you, Masa. Thanks for watching. And Moses, very, very interesting and vital topic. Yeah, thank you. And by the way, Moses, yeah, maybe you and I can do a show together someday. And also, Masa, I think Masa and I did a show already. So I'm trying to get my social worker and my psychological, but I had some other people on before. So maybe we can kind of, get together and do some collaboration. All right. And Mike Hines said, always giving us educational topic for the advice. Thanks, Miss Abby. Thank you so much, Mike. You're always one of my biggest supporter. So thank you all for watching. And again, like I said, the resources and the help is out there, but just take some time and get there, all and just breathe it through. And I have some people who reached out to me and wanted me to like kind of, talk to family members and things like that. So I can give personal advice. I can only give like advice, and anything else I can give you the resources that you need or point you towards the resources that you need. Okay. So thank you all for watching. Thank you all for watching. I really appreciate it. And Leave all of my people who are in psych part of the men's social service. If you want to leave any information down below for other people who will be watching and reading along the comments, please, I really appreciate it if you do that. Just add some more information there. And like I said, my other people who are other professionals, someday we can all collaborate, because this is all about, multidisciplinary team. It takes a whole village, the professionals and the family members and religious leaders and all of that, in order to help our family members and friends deal with this. Okay, so thank you all for watching, and I will see you guys on Tuesday. Take care, and good night. Enjoy the weekend. Be safe out there. Okay, bye.